Symptoms for enlarged prostate and food to avoid. Enlarged prostate, also known as benign prostatic hyperplasia (BPA, is a common condition that affects many men as they age. This non-cancerous enlargement of the prostate gland can lead to bothersome symptoms, impacting the quality of life. Recognizing the signs of an enlarged prostate and making informed dietary choices can play a crucial role in managing and preventing the progression of this condition. In this video, we will talk about the symptoms of prostatic hyperplasia and the foods to avoid it. Make sure to subscribe to our channel and press the bell icon to get regular updates. Let's get started. First, let's talk about the symptoms of an enlarged prostate. Frequent urination. Frequent urination stands out as a key indicator of an enlarged prostate, a condition characterized by the abnormal growth of the prostate gland. This symptom becomes particularly noticeable, especially during the nighttime. The underlying mechanism at play involves the enlarged prostate exerting pressure on the urethra, the tube responsible for carrying urine from the bladder out of the body. As a result, the normal and efficient flow of urine is disrupted, leading to an increased need to urinate more frequently. This disruption not only affects the quantity of urine expelled, but also disrupts the regular sleep patterns of individuals, causing them to wake up during the night to address this heightened urge to urinate. Difficulty starting or stopping urination. Men who have an enlarged prostate often encounter challenges when it comes to beginning or ending the process of urination. This difficulty arises from the obstruction created by the enlarged gland, which in turn results in a weakened urinary stream. Essentially, the prostate, a walnut-sized gland located beneath the bladder, can grow larger over time, pressing against the urethra, the tube responsible for carrying urine from the bladder out of the body. As a consequence, the smooth flow of urine is disrupted, making it problematic for individuals to initiate the process or bring it to a halt seamlessly. Incomplete emptying of the bladder. After urinating, many people feel like their bladder is still not empty. This is a common symptom of some health problems. When the urethra, the tube that carries pee from the bladder out of the body, gets blocked, this feeling happens. The bladder can't empty because of this blockage, which makes it hard for pee to flow freely. Because of this, some people may feel like they need to go to the bathroom, even after they've tried to empty their bladder. This sign could mean several different problems with the urinary system. Dribbling at the end of urination. Men who have an enlarged prostate may encounter a bothersome issue known as post-void dribbling, where tiny amounts of urine persistently leak even after they believe they have finished urinating. This occurrence can prove to be not only inconvenient but also quite embarrassing for those affected. The enlarged prostate can obstruct the normal flow of urine, leading to residual urine in the urethra. As a result, when men think they have completed urination and put everything away, they might still experience dribbling. Urinary urgency. Urinary urgency, a common manifestation of an enlarged prostate, unveils itself as an abrupt and compelling need to urinate, posing a considerable challenge to one's ability to control the urge. This symptom, born out of an enlarged prostate, not only disrupts the normal flow of daily activities, but also has the potential to evoke anxiety in those affected by it. The intensified and sudden nature of the urge to urinate creates a disruptive force, making it difficult for individuals to manage and maintain their usual routines. The impact extends beyond the physiological realm, seeping into the emotional and psychological dimensions of daily life. Straining during urination. When men have an enlarged prostate, they frequently encounter the necessity to exert extra effort during urination. This is because the enlarged prostate obstructs the normal flow of urine. The act of straining to urinate can lead to feelings of discomfort and may lead to a diminished force in the urinary stream. Essentially, the enlarged prostate creates a hindrance in the urinary process, prompting men to exert additional force during urination, which not only causes discomfort, but also manifests as a weakened stream of urine. Food to avoid for prostate health. Making mindful dietary choices can be a proactive approach to manage and potentially prevent the progression of an enlarged prostate. While there is no one-size-fits-all diet, certain foods and habits may be beneficial for prostate health, while others should be limited or avoided. Limit caffeine and alcohol intake. Managing the intake of caffeine and alcohol plays a crucial role in maintaining a healthy bladder, especially for individuals dealing with symptoms related to an enlarged prostate. Consuming excessive amounts of caffeine and alcohol has the potential to irritate the bladder, exacerbating urinary issues. Due to its diuretic properties, caffeine and alcohol may make you feel more compelled to use the restroom. Additionally, consuming these drinks, particularly late at night, can irritate the bladder, increasing the likelihood that you'll need to use the restroom. Therefore, it is recommended to exercise moderation in the consumption of caffeinated beverages, such as coffee, and to restrict alcohol intake. By doing so, one can contribute to the overall well-being of the bladder, helping to alleviate discomfort and promote better urinary health. This simple adjustment in lifestyle choices can have a positive impact on individuals experiencing symptoms associated with an enlarged prostate, allowing them to better manage their condition and enhance their quality of life. Reduce spicy foods. Cutting back on spicy foods, especially those infused with chili peppers and hot spices, can be beneficial for individuals dealing with an enlarged prostate. These foods have the potential to worsen urinary symptoms by irritating the bladder and prostate, and may bring on the urinary symptoms associated with PPH, such as feeling the need to urinate frequently and urgently. Steering clear of excessively spicy cuisine may prove helpful in managing and alleviating these symptoms. By adopting a diet that is milder in spice content, individuals with an enlarged prostate can potentially reduce the irritation to their bladder and consequently experience a decrease in discomfort associated with urination. This dietary adjustment is a simple yet effective measure that can contribute to improved overall well-being for those dealing with an enlarged prostate. Watch sodium intake. For good prostate health, you need to pay close attention to how much salt you take in. High sodium diets may make it easier to retain water, which can make urinary problems caused by a swollen prostate worse. If you want to live a better life, you should watch how much sodium you eat. To do this, you should avoid prepared foods, which usually have a lot of salt, and instead choose fresh, whole foods. Eggs. For a while, we thought that the cholesterol in eggs could be bad for our health. However, it turns out that the impact of dietary cholesterol on our blood cholesterol is not that significant. Surprisingly, other elements in eggs might have a more lasting effect on the prostate. Recent research indicates that choline, present in eggs, and its metabolite betaine, could increase the risk of prostate cancer, a potentially deadly condition. Consuming more choline has been associated with a 70% higher likelihood of developing prostate cancer. It's worth noting that choline is not exclusive to eggs. It can also be found in various foods like milk and pork. Therefore, the key is not to avoid a single meal, but to be mindful of our overall eating habits, steering away from excessive consumption of such foods. Limit red and processed meats. Recent research indicates a potential correlation between a diet rich in red and processed meats and a heightened likelihood of experiencing prostate enlargement. Red meat is problematic because it raises your body's arachidonic acid levels, which in turn causes inflammation, exactly what your enlarged prostate does not need. It is advisable to consider modifying dietary choices by prioritizing lean protein sources like poultry, fish, and plant-based alternatives. These adjustments align with health recommendations that emphasize the benefits of incorporating nutrient-dense foods into one's daily intake. By opting for lean protein options, individuals may not only mitigate potential risks associated with prostate enlargement, but also promote overall well-being. Moderate dairy consumption. Moderate consumption of dairy products is advisable, as they serve as a valuable source of calcium, crucial for maintaining bone health. However, it is essential to be mindful of potential drawbacks associated with excessive dairy intake. Dairy is high in saturated fats, and inflammatory chemicals can worsen your prostate-related symptoms. As a result of this, it may help your enlarged prostate symptoms to reduce your intake of dairy. Striking a balance in one's approach to dairy consumption is key, and opting for low-fat or non-dairy alternatives can be a wise and prudent choice. This ensures that the benefits of calcium are retained without exposing the individual to potential health risks associated with overindulgence in dairy products. By making these simple adjustments in lifestyle and diet, individuals can proactively manage and potentially prevent the progression of an enlarged prostate, enhancing their overall quality of life. Don't forget to subscribe to our channel for more valuable updates on health and well-being. Thanks for watching till the end.